Well, good afternoon, everyone. Uh, my name is Kevin Dunn. I'm the director of the Division of Developmental Disabilities, and I just wanted to thank everyone for taking the time out of your busy days and your busy lives to join us today to talk about the Family Support 360 waiver amendment, and also to really gather some ideas and some thoughts that you have about family support and what we can do to maybe provide some flexibility in that waiver amendment. So your ideas and your feedback is very important. And so we just want you to be open and honest and share any thoughts that you might have. Um, Next, I just want to kind of introduce some of the DD staff that we've got present today. I'm going to start with Brett Spencer. Go ahead and introduce yourself.
Good afternoon. My name is Brett Spencer. I go by Spencer. I am relatively new to the division. I've been here for about 3.5 weeks. I am the new assistant director, working with Kevin and with Cade and some of the other staff there. My philosophy is this is a team, us and you, and anything that we can do within the rules to try to help you to make things better and make your lives better. I'm all about that. So a little while later, I'll stick my email in the chat. If you ever have any questions about this or anything else, you can always reach out to me. I might not have the answer, but I can definitely try to find it for you. So I look forward to meeting those of you in person that I haven't met.
Cade, do you want to go next?
Yeah, sure, Kevin. Kate Anderson, HCBS Operations Manager at the Division of Developmental Disabilities. Kind of be walking through some of the different material today. Kind of look forward to talking with everyone. And if everyone feels comfortable, please just put your first name, where you're from, and your role in the chat. We would appreciate that. And then I think we'll kind of jump in a little bit into the agenda for today. We just met the DD director and assistant director. We really want this to be a creative space for you to share your thoughts, questions, ideas. Really want it to be really open for everyone to just be able to share. We will talk a little bit about the upcoming waiver amendment, kind of some of the pieces there, including what we've heard from families in the past and kind of how we hope to partner with them going forward. And then we really want to get your ideas on feedback to possible changes to Family Support 360 kind of going forward. We really do want to understand what families and participants' wants and needs are kind of around Family Support 360 or in general. So we really just want to try to get a grasp of that here today. It is planned for an hour. If it goes a little over, that is okay. I am available to be on for a little bit past that. So, all right. I think the first thing we kind of have up is a little bit of Q&A with the director. Kevin was brave enough to kind of jump in there and just kind of offer up his time to be able to, if you have any questions that you want to ask, feel free to ask him. Any concerns, anything you want to share, you can definitely unmute or write in the chat if you want to ask your question that way. But yeah, it's kind of open mic for Kevin. And if you have questions.
All right. Thanks, Kate. We got some really good feedback and ideas last night, I thought, at the town hall. So kind of looking forward to seeing any thoughts that you might have, any questions that you might have that we can answer. And I might not be able to answer. I might defer to Cade with some of the questions, but please feel free.
And if you guys don't have questions right away, just put them in the chat and we'll try to get to them kind of as the meeting goes. But right now is a really good opportunity for anyone that has a question for our director. Kevin. Kevin, it looks like they're letting you off the hook today.
Oh, this is fantastic. Now, if there's questions that you come up with later, please feel free to send me an email, call me, whatever is easier for you. I put my email in the chat box. Contact me anytime.
All right, we did actually just have a question pop up.
Sure.
With the waiver on the funding chopping block, do you have any updates?
I'm not aware that the waiver is on the funding chopping.
I'm kind of wondering if they just kind of mean, budgets are always tight everywhere. Is there any chance, plans for, Family Support 360? Is that going to be affected in any way, or hard to
Well,
say?
I wouldn't say, I mean, but all budgets are looked at, but no, it's, we put in the same budget request, that we have. So I don't feel it's in danger.
And I don't know if you want to take that further, Kevin, but I know there have been some questions in the past about things have been changing in the federal government. As far as we know, as far as I have heard, nothing about what we do being in danger.
Yeah, and Michelle put in a message in there, or Dr. Powers put in a message about the reconciliation package. I'm actually going to be on a call on Monday of next week to learn more about that.
And I think there's just a little bit of a follow-up question there. Are there any specific changes that we as parents should be aware of?
Regarding
I feel better. I'm guessing it's kind of regarding some of that previous conversation around the reconciliation package. And
I still think there's a lot to learn about it, to be honest with you. I mean, I'm in a very beginning stages. That call on Monday that I'm on, it's a national call where I'm going to learn more about, what they're talking about, because nothing's been decided yet either.
Can I make a comment?
Sure.
So what we're hearing on the national level is maybe different than Kevin, what I think maybe you guys have been informed. So I think I can speak to, as a parent, we're worried and concerned. Okay. And so and we get questions all the time from families in our family support program. What are we hearing? What do we know? Whether it's a rumor or not a rumor, or it's factual, but I think we have to be cognizant that the information being shared publicly, whatever news you listen to, is talking about cuts. And so I think that's what I can tell you. That's what I'm wondering about and concerned about. And that's what our families are wondering about and concerning about. So I want to be very clear about that. That's the concern that we have, and how that will affect our families.
Thank you for sharing, Terry. And like I said, as we gain any information, we'll be sharing it with all of our stakeholders.
Hey, Kevin, Dr. Powers was asking about the executive order on DEI and if that has affected us or not.
I'm not aware of how it's had any effect on us.
And then Teresa had a question there. The letter states changes to the Family Support 360 waiver. What are the possible changes? And we'll probably get into that a little bit further in the slideshow when we go through some of the information.
This is Heidi at Lifescape in Sioux Falls. I just wanted to kind of reiterate what Terry said. I know there's no real answers to that question right now, but I think it's important that we know and understand that that is probably the number one concern of families right now. Every meeting that I go to, that's what I get asked. How will these changes impact my child and our family. And so I know right now we don't know that information, or we believe that it won't impact our services, but I think we need to understand that that is a huge concern amongst our program participants at this time.
Absolutely. Thanks for sharing, Heidi.
And Kevin, that's kind of the question I was asking last night. Just to kind of follow up, that's where me as a parent, plus I'm on family support. That's what I was asking last night.
Yeah, and I'm
I'm
hoping,
on a
like I
Zoom
said,
for the
there's actually two calls. It's
out of the division.
oh, I'm sorry. There's actually two calls that I'm going to be participating in early next week. National calls where it's a national organization that I'm learning more about, what's being discussed and the process. And like I said, we'll share any and all information with all of our stakeholders as we receive it.
All right, I think there's one more question here. I have recently heard that there is managed and unmanaged Medicaid. Does that apply to most of our families? And if so, which category?
I would say, Lori, I'll have to get back to you with that one. Could you send some contact information to me and I can get back to you with an answer there?
Right. Well, I think that was a lot of really good questions for Kevin. Kevin and Spencer, I think we really appreciate you guys just taking a little bit of time out of your day to kind of answer the people's questions.
No,
And as
I cherish these opportunities because this is really where we're getting some of our best ideas and some of the best feedback that we can get, when we're making changes, whether it be policy changes or anything like that. These are very important times for us. So thank you all for taking the time to participating in this. And we love the feedback, and we would want you to continue to reach out to us if you ever have any questions or concerns.
Yeah, absolutely. Thanks a lot, Kevin, for being available today. Really appreciate it. Otherwise, I think we will kind of keep going into the material so we can get kind of through it all. But like I said, if you guys have questions that pop up throughout this meeting, please just drop them in the chat, and we'll try to get through them as soon as possible. So we do have just a quick kind of update, just a note from DSS on some recent communications. This is something that's kind of been going on for a little while now, and it won't apply to everybody, but some of the families that do happen to get some of these letters, I know it does raise a concern. So we just kind of want to address it a little bit, and provide a little bit of guidance around it. But people have received reminder and termination notices from DSS over the last couple months. In September of 2024, DSS restarted the process of renewing people's Medicaid eligibility, with the possibility of disenrollments on December 1st of 2024. Since then, automated reminders are sent when a renewal has not been returned, and automated termination notices have been sent when a renewal is not complete. Some termination notices were incorrect, and eligibility staff or long-term care staff have been working to limit and stop this from occurring. Like I kind of mentioned in there, a lot of these were automated letters that were sent out. Some of the best things you can do is on the letter, it does have a contact number that you can reach out to. That is kind of one of the first steps that you should take, is kind of reaching out to that number if you're unsure. One of the other steps you can take is to reach out to your family support coordinator. And as soon as you get the letter, if you're having questions on it, and kind of just talk through what the letter states. So if you receive supplemental Social Security income or SSI, you should still be eligible even if you received an automated reminder notice or termination notice. If you receive a renewal packet, you must complete and return the form and any requested verifications, such as copies of bank statements. It's important to always open and read your your mail from DSS. If a renewal form is required and you do not return it, your eligibility could close. That's where we're seeing a lot of these, as people are not completing some of this information and returning it. DSS will send out multiple notifications, at least 2, sometimes 3 notices if this is occurring. So just be mindful of that. Make sure you're reading your mail if you're getting it from DSS, and if they're asking for any information, please get that returned to them, so you don't run into any issues, and your eligibility just continues. Like I kind of said, reach out to your family support coordinator if you do happen to get these letters and have questions on them. If not, there is a phone number on the letters that you can reach out to, or you can call or email your long-term care benefits specialist. Just kind of making everyone aware of it, so you're kind of know what to do if you happen to get these letters. Some of them are automated, and there are kind of mistakes at times. So
Some termination notice were incorrect.
Just be aware of it. So I think next we kind of have just a little bit of background on what Family Support 360 is. Kind of going back to a little bit of the basics on what a waiver is, kind of what that kind of looks like. Like I said, this just giving you guys a brief update on it. And so kind of just the basics of it. Waivers are special permission Medicaid gives to states that allow people with significant health needs to get services and supports in their own homes or in a community setting. The goal is to keep people out of living in a state institution. One of the key factors of a Medicaid waiver is to get more people enrolled into Medicaid. And a waiver gives states more flexibility around the services that they can provide and how to provide them. So it kind of goes above and beyond general Medicaid, and kind of gives more flexibility around different services that can be approved. So a lot of times you'll hear that acronym HCBS. It's just short for Home and Community-Based Services. So these services are provided in a person or family's home or community. A person must be eligible for Medicaid and apply for an HCBS waiver program to have access to these services. So there is kind of a 2-part process. You do have to be eligible for Medicaid to qualify for the Family Support 360 waiver. One of the neat things about the Family Support 360 waiver is we do, from that Medicaid aspect, is they only look at the income of the child or the participant who's applying, not the family unit as a whole. So that's kind of just a neat thing about the Family Support 360 waiver. And then the HCBS waiver helps people use services in their home and community. And then to give just a little bit more on what Family Support 360 does cover, it is for individuals with intellectual and developmental disabilities in South Dakota. So the Division of Developmental Disabilities does oversee this waiver, but we do have to report to Department of Social Services, who then reports to the federal government. But we just provide the oversight on the kind of the day-to-day function of the Family Support 360 waiver. We do serve individuals from birth all the way up to 99, 100, whatever it happens to be, so all ages. There are certain eligibility requirements. Some of those are financial. You do have to have an intellectual or developmental disability. And then one of the other kind of neat things that comes with Family Support 360 waiver is it's self-directed. So you do have some control over the services that are provided to your loved one. Some of the different services, we do have service coordination. A lot of times case management, service coordination are very similar. Companion care services, specialized adaptive equipment, respite care, environmental accessibility, vehicle modifications, personal care, nutritional supplements, supported employment, and then we do also have some other general funded services as well that are a part of Family Support 360. We do also have some helpful videos there's a link attached here. looks like Ben kind of included it there in the chat. That's are very helpful. Just kind of quick videos that kind of go do a brief overview of what Family Support 360 is. So that's just kind of a rough background on what waivers are and what kind of the Family Support 360 waiver offers. And next we're gonna kind of get into the waiver amendment. So we'll kind of give a little bit of background on our past waiver amendment and kind of where we're looking to go in the future. So an HCBS waiver is pretty flexible. Once an initial application is approved, it can be amended or changed. In 2024, DDD partnered with the community to amend the Family Support 360 waiver and stabilize agency with choice. DDD is now working with the community to expand flexibility and clarify policies for Family Support 360 with a second waiver amendment. And hold on just 1 second. I need to get a quick drink here. Sorry about that, everyone. Voice started going away. So the step one, this one has kind of occurred in 2024, and that was to find a stable and sustainable solution for agency with choice. And then step two, which we're currently kind of in, is work with families to expand flexibility and clarify policies for Family Support 360, including agency with choice, including adding agency with choice as a waiver service. So kind of what our past engagement kind of looked like is we really appreciated all the feedback we received from people and families on what had been working and what wasn't working around kind of agency with choice and common law. We use that feedback to guide our contract with our new agency with choice vendor. We then facilitated town halls to share information, kind of like we're doing now. And then we hosted 10 family work group meetings to kind of learn more and plan for that implementation. So kind of the engagement plan going forward is we're going to continue these town halls and listening sessions, kind of to share and gather information, then reopen the family work group, which we already have done. And then we're looking for new members. So if you're interested in, becoming a member of the family work group, Carrie Geppert is the main contact, but if you reach out to me, I can get you in touch with her. I just included my email address there in the chat. So if you're interested in the family work group, please reach out. I'll get you in contact with Carrie and she can kind of get you set up with that. So we do provide information sheet. We're looking to provide an information sheet on the second waiver amendment, then facilitating a formal public comment period. So this is kind of the timeline. This is kind of what we're looking at from winter to spring of this year. So with most, government processes, the process, it tends to take some time. It's multiple steps. We're kind of completed the first couple steps, which was announcing the second Family Support 360 waiver amendment, and then distributing the town hall invitation. So we're kind of on that step 3 of first round of statewide town halls. So right now we're just gathering information from families and feedback, and then kind of looking at our next couple steps is the family work group and family support council meet. I think the work group's meeting at least every month, if not every 2-3 weeks. And the next family support council meeting is actually next weekend in Sioux Falls. It's the Holiday Inn Express Empire Mall is where it will be. It's Friday night from 6 to 8 p.m. and then Saturday morning from 8:30 to noon. And so we'll kind of be going through some different things with them as well. So the second round of statewide town halls will kind of come after those meetings. And then we'll draft the waiver amendment. So this is kind of looking, the next couple are spring to summer of 2025. So kind of after we work with families, get all this information, kind of do the initial creation of the waiver amendment, we have to post a 30-day public comment period, which gives families an opportunity to provide any sort of feedback that they might have. We really want to hear, what's important to and for you in that public comment period. Just anything that you guys might have, we really want to hear that. So then after we resolve the public comment and kind of submit that amendment to Medicaid or CMS, CMS has 90 days to review that. And most times it does take close to that 90-day mark. And then once that's approved, we'll announce that, and then we'll look towards implementing those changes with the waiver amendment. So next up, we kind of have a little bit of engagement here. So how else would you like to engage with DDD on the waiver amendment? So we're going to pop up a quick Zoom poll. So please just share kind of what your choice would be. Some different ideas that we kind of have are surveys, attending the Family Support Council, in-person listening tours, sharing sessions, and then sharing ideas with your family support coordinator to bring to us, and then town hall meetings like this one. All right, it's looking like we've had quite a few responses. And it's kind of funny, last night surveys actually won the poll, but it's good to see all this good feedback. It really helps us narrow down on how to communicate, how individuals and families like to be communicated to, or communicated with is a better word. Yeah, and absolutely. Tori had a good comment. If you have any other ideas, please just drop them in the chat. Gladly take any ideas, feedback that anyone has. But yeah, we really appreciate everyone participating in the survey. It just helps us narrow down on how we engage with y'all. All right. So this is kind of what we've heard from people and families in some of the meetings that we've had so far. And some of these meetings can stretch back for quite a ways. But this is kind of from everything we've gathered, this is kind of some of the key points that are kind of sticking out. So one thing to kind of keep in mind is we're not going to be able to change everything now. That's just not super realistic. But we do really want to make sure we're working from the right list of wants and needs as we think about what is possible. We're going to try to do as much as we can, but that's just we just can't cover everything just right now. So one of the key things that has kind of popped up is expanding flexibility. And so this is we've seen some interest in expanding different types of specialized therapies, desire for Family Support 360 to cover low cost items that kind of support independence, such as blenders, mattress encasements, and smaller sensory items. And then adding agency with choice as a waiver service to give families more options on who they can work with. We are going to kind of open it up if you have additional comments, other ways you think we can expand flexibility. Gladly take those. You can definitely drop them into chat if that's an option. And a lot of times, I think one of the things we heard last night is kind of a chain reaction. So the sharing of ideas kind of triggers you to have more thoughts. So it's okay. If you have an idea, put it in the chat and it might spur someone else to have an idea. So one of the other things that we kind of, I think, maybe have dropped the ball on a little bit in the past is clarifying policies and communications. Families really want to understand what is covered and what isn't, in kind of a really easy format. So we're trying to create simple resources to help families better understand the Family Support 360 program as a whole, and then kind of some of those different services that are covered under Family Support 360. And then we're kind of also going to try to develop a little bit more comprehensive list of resources, because not all resources are going to be through Family Support 360. A lot of them could be through your local community, churches, whatever it happens to be. Sometimes the Family Support 360 program is a little bit more limited. And so sometimes there's other options that would better fit and better manage that need that you might have. Developing clear guidance on monitoring devices and the conditions in which must be met for them to be approved. We are right now learning from peer states, and we just want to kind of get this right. So we are kind of researching, and once we come up with some clear guidance on it, we will definitely distribute that out. But we just want to make sure we get it right. And as soon as we have that clarified, we'll be sure and let everyone know. So I'm just kind of going to open it up just a little bit. Is there anything else? Is there stuff that you think we're missing, not missing? And then you can also share anonymously. We have a Mentimeter here. Just scan the code and you can share that way as well. It's anonymous, so you can, name's not attached to it, if you feel more comfortable doing it that way. So we did just have a comment from Teresa with some feedback in regards to expanding flexibility. Support needs that a doctor or licensed therapy provider state would be beneficial for a child. In the past, a need was denied even if a doctor provided a letter and reason. The program should consider that a doctor or licensed therapist knows what a child needs. No, I think that's good feedback, Teresa. And we'll definitely take that into consideration.
Okay, this is Kylie Withrow, pediatric therapist at MoveU. I know we've had conversations in the past about our services being considered potentially specialized therapy based on the very unique and truly specialized approaches that we do utilize within our clinic. And I know a lot of our clients and their families have really been pushing and talking to their coordinators about MoveU fitting under that category. I was just curious from other coordinators or yourself, what kind of feedback have you gotten from them or their interest in this being covered under the waiver amendment, and how that might fit in that first bullet that you have under expand flexibility.
Nope, Kylie, I really appreciate your comment. Yours is one that we've actually heard from multiple, your agency is one that we've heard from multiple people, families, family support coordinators. And that is kind of something we are definitely considering right now, kind of in that expanded specialized therapies category.
Thank you.
Mm-hmm. So we have a little more feedback and expanding flexibility. A child that is medically complex does have different or varied needs, and so I'd like the possible changes to consider being more inclusive to meet the needs of a medically complex child. Okay. I think I would need, Teresa, if you want, my email address is in there. If you wouldn't mind expanding on that a little bit. Would love to hear more. Another one of therapy items for home, so individuals can continue to work on building strength and improving mobility, etc. Okay, we can definitely consider that. And thank you for the input, Christine.
There's quite a few submissions in the anonymous mentee. The first submission is, where are we at with bringing back fences as a covered item?
So we do cover up to $2,500 towards fences for a participant who has elopement concerns. So we do cover up to $2,500 towards that cost.
Another person said, would like to see vision therapy, other holistic medical therapies, etc., from certified providers, all be considered.
Nope, that we're definitely considering different types of therapy services. We are kind of looking to see if it's possible to expand the specialized therapies to include some more. So these are all good examples. Definitely like to hear them all.
Another person
sorry, go ahead, Ben.
I was just going to say, another person said that they would appreciate a more person-centered approach regarding needs and approvals, rather than a black and white approach. Another person said, considering a tool that could be adaptive to a participant may not be adaptive to you or I. For example, Bluetooth appliances for independence in cooking meals for themselves safely. Items that are considered therapy items recommended to help them at home should be covered. Vision therapy services should be covered under specialized therapies. This is developmental therapy.
No, absolutely. These are all really good things. This is the kind of stuff we wanted to hear from everyone. So thank you everyone for contributing and providing your input. We did just have one more drop in, and then we'll probably jump into the next topic. But if expanding specialized services, then the amount available needs to increase. There's some truth to that. We're definitely, I think like everyone, we do have to look at budgets and see what's doable and not doable. So it's definitely something that needs to be considered. And if we do add other therapies, that categories limit might need to be increased. And then we had one last comment, and then we're going to jump to the next topic. But I would like to see an increased amount in fences, as it really is a safety concern for many children due to their diagnoses. Many fences are over the limited amount. And that's true. $2,500 really doesn't get you super far when it comes to putting in a new fence. Especially even chain link fences can be quite expensive. So $2,500 doesn't get you too far. It does cover something, but it really wouldn't cover the whole thing. Likely wouldn't cover the whole thing. So thanks for that, Jessica. Like I said, everyone really appreciate everyone's feedback. Great ideas, great topics.
Hey, Kate, we have one other question in the chat. Wasn't agency with choice already added into the last waiver amendment done last summer? I know we're going to get into that a little bit later, but maybe you could speak to that a bit right now.
So I think I would actually kind of turn it back to A&M to answer it a little bit. I just don't want to give false information on it.
I'd be happy to jump in, Cade, and
go ahead,
share more
Shivani.
on this one. So, hey, everybody. I think I know a good handful of folks on the call, but my name is Shivani Patel, and I've been supporting DDD and Cade and Kevin specifically on the agency with choice transition last summer. So, with the kind of urgency that with the urgency that we had last summer to work with a new provider and get a new provider with the state, we actually did that through a contract. So the next phase of this would actually be moving it into the waiver as a waiver service. So a little bit different, Terry. So mechanically, maybe nothing kind of looks different from the outside in, but what the waiver will help do, and we'll talk about this in a couple slides as well, is offer the opportunity for other providers to also provide this service. So it's not just up to, a single contract with a single provider, and it opens up the
Great.
opportunity for others to be able to do that again in the
I
future.
was getting a little nervous.
Glad to share that then.
Your probing question to me was like, oh, I think I was doing it okay.
All right. Thanks so much for that response, Shivani. Really appreciate it. Thanks for clarifying that.
And just to quickly share some of the remaining submissions in the Menti, there were a lot of submissions, but generally a lot of people wrote that they wanted more flexibility around specialized therapies and technology like communication technology and internet supports. And there were a few suggestions around increasing flexibility around the recreation service as well. So thank you everyone for submitting those comments.
Absolutely. Really do appreciate everyone that contributed. Can't get ideas if we're not getting them from everyone. And all avenues are, everyone has a different viewpoint, and we appreciate all of them. So, all right, I think we will kind of jump to the next topic though, of kind of just digging in a little bit deeper on expanding flexibility and agency with choice. So agency with choice is one way that people using personal care, companion care, respite care, and supported employment can manage their supports. Agency with choice allows people to partner with a vendor that helps them with employee management tasks. These tasks include paying taxes, filing paperwork, and in complying with federal employment laws. So basically, this Family Support 360 amendment will make agency with choice a waiver service, which then creates the option for vendors beyond consumer direct to serve families. So it just kind of opens up the provider pool a little bit. So the current contracted vendor for agency with choice is consumer direct. We have Acumen for common law, but this kind of just relates to the agency with choice aspect. So the Family Support 360 amendment will kind of move agency with choice to a waiver service. And this just opens it up for people and families. Like I said, it's really just a way to make it more accessible for more providers to offer agency with choice. So kind of next we have clarifying policies and communications and kind of family resources. So we kind of heard that families want to understand what's covered and what isn't covered under Family Support 360, and they kind of want a version that's more family friendly and just kind of easier to read. So we're writing short guides about Family Support 360 services and supports in collaboration with the family work group. They are usually reviewing these documents. The Family Support Council is also reviewing these documents. So we've completed a respite care version and a companion care one. And then right now we are working on an assistive technology guide as well. So this is just a brief taste of what the respite care overview kind of looks like. I think as we develop these, we're really hoping to just make them much more user-friendly. And I think one of the things we need to kind of keep considering, we kind of want to get this information or get the feedback as early as possible, because we don't want to complete the whole project and then get to the end and then people have ideas. So that's why we're still kind of in the beginning phases. We're really hoping to get a little feedback on what other things we should be considering as we're developing these. So that's kind of, we do have some questions of just as we're thinking about this, about making more resources, what are some things we should be considering? And then what communications would help you use Family Support 360? Just kind of what are maybe some things we haven't thought about? You know, just whatever it happens to be.
Kate, one thing I question for one of these guides is for SMAs, those specialized therapy things like this one's covered and this one's not, to kind of give a clear guidance, not only to me as a family support coordinator, but for families, because something might be covered and then a different thing might not. Does that make sense?
Oh, absolutely. A good example would be communication devices. We can cover them for some individuals, but not others, and for certain reasons. So I
Or
think
like
some
those
clear. Oh, sorry, go ahead,
sensory
Ashley.
things they lay in, but a sensory swing can be. You know, sometimes that isn't clear. So then when I tell families, they're like, well, that doesn't make sense. Well, it's just how it is. So I wonder if there's a way to make that clear. I don't know.
No, absolutely. That's just good feedback, Ashley. It is something we're definitely considering when we're haven't quite assistive technology is a little bit, the one we're developing now is a little bit broader than just SMAs. And it's not focused completely on it, but SMAs is coming up. So it is something we're going to be looking at and how we can do that in an effective manner that really just does make sense.
Thank you for sharing that, Ashley. It's helpful.
Yep. So we will kind of continue to update these guides and post the updated versions to the DHS website as they become available. Like I said, we'll try to give updates. You know, the Family Support Council, we will be reviewing them. The Family Support Work Group will be reviewing these. And as soon as we have, you know, a good working version, we'll be posting them to the website. So closing, we have just kind of what next steps kind of look like. So first off, I just want to say thank you for everyone for attending. If you have questions and you want to ask them, now would be a great time. So you can ask out loud through the chat or share feedback using the Menti. So yeah, if you guys have any questions, this is kind of we're kind of getting to the wrap up phase of it. So if you have questions, now would be good. Ben, are we having anything kind of come in through the Menti?
Nothing yet, Cade.
All right, thanks. Well, I did include my email in the chat. I think we just have one more slide on how you can sign up for emails. But we'll just kind of pause for just a minute, give anyone a chance if there has a question to ask it.
Kate, I have one more that I was thinking
Yeah.
about from the other day.
Yep.
Safety with internet is a huge concern for people with disabilities because they don't understand that. There are things like bark apps and things, but finding a way to be able to cover things like that, because it's one of those main issues that I see kind of across the board for some adults. And honestly, even teenage kids at times too, with disabilities.
No, absolutely, Ashley. I think we've heard, like the bark app was mentioned last night, but I think just in general, safety with internet, I think that's just a good topic to have and to be considering and see how we could incorporate it into the waiver in some way. But yeah, I like it, and we'll have to be thinking about that one a little bit.
One of the things on that same topic that Ashley was mentioning is we know there's nothing is black and white, right? It's always based upon the individual, the situation, their needs. And so if there's a way or possibility similar to other things that we look at, like a rights restriction, if there's a document that we could work through, you know, with the division of, is this approvable? Why or why not? And, so, you know, does it meet this need? Does it meet that need? So there's some kind of a concrete way that we know that a family can understand why it meets the need, or why it's allowed, or why it's not allowed. Kind of like a black and white kind of communication versus us just saying, well, we submitted a goal and it's not approved. And because the financial guidelines say this, because everything is so different based upon the person, their need, their disability, and I think safety, especially with technology, safety is so paramount for all of our families. And we rely on technology, right? And we want them for independence, but some of these really less expensive apps possibly, or products, are just not meeting kind of the test of being allowed. So if we could find a way to maybe think through that a little bit bigger.
No, I really liked your idea of having a document. I mean, it's kind of like a yes, no, go to this
Yeah.
box, yes, no, go to this box.
Right.
But I think it's a workable solution and adds a little bit of clarity.
Yeah.
So I do like that idea, Terry, and we'll have to see if there's a way we can explore it a little bit more.
But thank you for taking that comment. I appreciate it.
Yep. All right. Well, like I said, I appreciate everyone for showing up today, providing input, um, you know, just learning more information. Really appreciate everyone for showing up and participating. There's one more slide on if you guys do want to receive emails from DDD, you can sure scan the QR code, and this will kind of help get you set up to receive more updates. You can also sign up for the DDD emails using the link provided there. Like I said, if you want more updates, definitely go to our website, sign up, and we'll get those out as they become available. I'll stay on for a little bit if you have questions. Otherwise, this is kind of the material for today. So thank you all for joining.
Yeah, and I'll echo Kate and thank you all for taking the time. This is really good feedback. These are really good ideas. And really do appreciate you not only taking the time, but providing that feedback. And also, I said it last night and I'll say it again today. I want to personally thank Cade for all the hard work that he puts in to the Family Support 360 program. He puts in a lot of long hours and a lot of effort into this. So thank you, Cade.
Thanks, Kevin.